Welcome to flu season. One of the primary reasons why you're going to show up in a place like this with a very sick child. In fact, most people are going to describe the flu as the sickest they've ever seen their kid. Now, the flu is a respiratory disease, and it's spread through respiratory droplets. So you're going to get it when you're in close contact with someone that's sick. The problem is they may not even know they're sick yet because it's contagious one day before they even have any symptoms, and then up to 2 to 5 afterwards. You're going to be contagious when you're around them, when they're coughing, when they're sneezing, and even through fomites. Someplace where they may have sneezed or coughed that you touch and then touch your eyes, nose, or mouth is going to be the way that it gets in your body. Now, the flu has a sudden onset with high fevers, usually 101 to 104, cough, congestion, headaches, and these severe myalgias, which are these terrible muscle aches in large muscle groups like your back, your upper arms, and your legs. Most people are going to be bedridden for the first couple of days. Now, the flu is terrible, and it tends to change all the time. It's mainly caused in humans by influenza A and influenza B. Now, the flu has a lot of secondary infections, things like pneumonias, ear infections, sinus infections, and can also lead to dehydration due to the high fever and the fact that you don't feel well enough to eat or drink. The main cause of death is usually pneumonia and dehydration, and it's predominantly in the elderly. In fact, 90% of the deaths happen in people over 65. The other 10% tend to happen in children younger than 3 and people who have underlying medical problems. Death rate from the flu varies from 4,500 per year up to 45,000 per year. And if we had a major change in the virus that causes the flu, we could have pandemics with death rates much, much higher than that. Now, when do you need to decide when you need to show up here? Well, if you have a child who has a sudden onset of a high fever of 101 to 104 that's feeling terrible, chances are you're going to show up here. And if we catch the flu fast enough in the first 48 hours by doing a test from a nasal swab, we can actually put them on antivirals. This is kind of like an antibiotic, except it's for a virus. And this could decrease how contagious you are, how long the disease lasts, and therefore decrease how often we get ear infections, pneumonias, or sinus infections. Now, if it's not in that first 48 hours, then you're going to be mainly treating symptomatically with some ibuprofen or acetaminophen for fever or aches and pains, lots of fluids, maybe some over-the-counter cough medicines to try and make your child feel better. But once that fever's gone, if it was to ever come back again, that's going to make you worry that you might have a secondary infection. If the fever lasts longer than 3 days or is going up over time, or if your child starts to have any problems breathing, chest pain, ear pain, point tenderness on their face that might indicate a sinus infection, or if your child's becoming more lethargic or having decreased urinary output where they're not having at least 4 wet diapers or voids per day, it's probably time to come here to make sure that we don't need IV fluid for dehydration or antibiotics for a secondary infection. Your best prevention for the flu is to get your flu shot every year, and it's something that's available after 6 months of age and should be given on a yearly basis. After that, it's good hand washing, and make sure that you're healthy during the winter time. Make sure you're getting good exercise, plenty of rest, and eating healthy. And again, wash your hands, wash your hands, wash your hands. And if you don't have access to water or soap, then hand sanitizer that you can carry around with you. You're going to know it's flu season. It's going to be all over the news. So if you have those symptoms of high fever, aches and pains, cough and congestion, try and get to the doctor as soon as possible so we can try and 1, take care of your child and hopefully keep the rest of your family from getting infected as well.